first, I want to welcome Amelia from the Northeastern Citizen Advocacy Incorporated. Amelia's going to chat today about the Royal Commission, the Disability Royal Commission. And so over to you, Amelia. Thank you so much for coming.
Thank you, Nicholas. And hi, everyone. Thanks for jumping in and listening to me chat. I'm going to share my screen with you because I've got some slides. It might mean I won't be able to see you all, which is not ideal, but I'll do my best to make that not feel weird as we go through this. So yeah, my name is Amelia. I'm from Northeast Citizen Advocacy. I'm an individual advocate, and I've been working to support people to engage with the Royal Commission. So that's the Disability Royal Commission into violence, abuse, neglect, and exploitation of people with disabilities. So I would also like to acknowledge that I'm presenting today from the lands of the Wurundjeri people of the Kulin Nation. I pay my respects to their elders past, present and emerging, and I acknowledge that sovereignty was never ceded and that the struggle for self-determination and justice for First Nations people is ongoing. All right, so I recognize that although not all of you are, I think, disability specific workers or members of the community, but I imagine we all have a common passion, which is advancing the full and dignified participation of all people in community. So the Disability Royal Commission offers a really valuable opportunity for the voices of people with disability to be elevated and to form the basis of some really much needed change. You might know a little bit about the Royal Commission, or the DRC. I'm going to refer to it as, just to save a little bit of time. I hope not to overload you with info, but I do hope to just clarify a few things with my presentation. Firstly, what do you need to know about the DRC? How people can share their story, my organisation's role in the Royal Commission, and how you as supporters can give information to the person that you support, and what further supports are available if they need counselling, emotional support, legal advice or advocacy. So I think when we're talking about what the Royal Commission is, a good place to start is to think about why we actually need one. So the cultural, political and practical landscapes surrounding disability in the last so ever many years have changed a lot, largely thanks to the disability rights movement, which really took off in the 70s and 80s. And people with disabilities and their families have always been at the forefront of that movement. There's been a move away from a segregated medical model of understanding and responding to disability, and a move towards an approach based on human rights, equity, autonomy, inclusion, and a belief in the inherent value of the individual. Despite the strength of this movement, however, violence, abuse, neglect, and exploitation of people with disability does persist. And an excerpt from the DRC's interim report states that in Australia, almost 2/3 of people with disability have experienced violence in their lifetime. And people with disability are twice as likely as people without disability to experience violence in a 12-month period. So this stat epitomizes what people with disability and their advocates have been maintaining for a long time now, which is that mistreatment is widespread and unfortunately it's structural. So the DRC was launched in April 2019 and it can be understood as a formal national investigation in response to community concern about widespread reports of violence, abuse, neglect and exploitation. Due to the effects of the pandemic, the DRC has actually been extended until September 2023 to allow for more time for people to share their story, which is really good. We were worried that wouldn't happen and it has, so that's excellent. The DRC takes a person-centered approach, which means, to quote the interim report again, the voices of people with disability are at the forefront of our work. People with disability are the ones who've experienced violence, abuse, neglect, and exploitation, and who can recount those experiences. They understand only too well the barriers to a more inclusive society. I'm sure we'll all agree that's basically the only way to go about doing such work, with the experiences of the people who we seek to support at the centre of that. So the DRC is looking into all forms of violence, abuse, neglect, and exploitation across all settings and contexts. So that could be at work, in group homes, at school, in support services, health services, correctional facilities as well. If a person has a story to share with the DRC, they want to hear it. And I'll touch on the specifics of how that info is gathered a little bit later on. It should be noted that the goal of the DRC is to transform community attitudes and bring about changes to policies and practices to promote full and effective participation and inclusion in society. And that's just like a lot of words that basically means informing changes that will hopefully bring about a fairer and safer environment for people with disability. So the DRC also takes an intersectional approach, which means they recognise the differences in lived experience of people with marginalised identities and how the discrimination they may receive based on those identities interacts with their lived experience of disability. So First Nations people, people from a culturally and linguistically diverse background, people from the LGBTQIA plus community, and women with disabilities are examples of some of these marginalised identities. I should say too, in recent forums amongst advocates, there's been quite a few challenges in engagement with people who want to come forward, generally speaking, but also specifically with these marginalised communities too. Challenges there included cultural differences in conceptualising and responding to disability, lack of safe and specific support services, mistrust and suspicion of the state and institutions, and a general sense of wondering what good can actually come of interacting with the DRC. And I will speak to that point a little bit later on as well, because I think that's a really important question to answer when we're thinking about these things. So what do these terms actually mean that the DRC is referring to? And this slide is a really good resource if you're having a conversation with somebody with disability in your life who might like to learn a bit more about the DRC. This is taken from their Easy Read guide. So they define violence as if someone is hurting you physically, abuse if someone is treating you badly, neglect if someone is not helping you the way that they are supposed to help you, and exploitation if someone is taking advantage of you. Obviously, all forms of violence, abuse, neglect, and exploitation against people with disability are not okay. So the DRC wants to hear from people who have a story to share. That could be people with direct experience, so people with disability themselves, family members, support workers such as yourselves, members of the community can also actually share stories with the Royal Commission. And they're not just interested in things that have gone wrong, so instances of mistreatment, but also means of best practice. So things that work well to safeguard people with disability from mistreatment are really good for the Royal Commission to receive too, really useful. So there's actually lots of different ways that people can share their story with the DRC. First is to prepare a submission. So this is an account of somebody's experience. It can be made by anyone, as I said, and there's different forms that it can take. It could be written by an individual or on behalf of somebody else if someone requires some support there. It can be given over the phone, a video can be sent in. It can also consist of like artwork, visual cues rather. Some people have even submitted like songs to tell their story. So whatever format is most accessible for somebody, the DRC wants to receive that in the form of a submission. Also, oh yeah, I've got here, as of August the 25th, there have been 2,857 submissions made. So just to give you a bit of scope on that. People can also attend a private session. So recording in progress. A meeting with a commissioner wherein the identity of the individual is confidential and protected under law. This pre-pandemic could occur in person, but currently this is only happening over video link. We've supported someone to have a private session before, and it basically just looked like helping them to get their story in order. Maybe they had some notes or things that they wanted to touch on. and they're on video link with the Commissioner, and the Commissioner will sometimes ask a few questions to clarify, but it's generally just that person sharing their story within a certain period of time. I believe people get usually 1 to 1.5 hours to share. There have been 482 private hearings undertaken to date. So people can also register to speak at a public forum. They allow for the DRC to share about their work and for the voices of people with disability to be heard in a very public way. And people may also be asked to speak at a public hearing. So this is a formal environment wherein witnesses are required to go under oath to give evidence, and they are recorded and streamed live on the DRC website. So there have been 18 public hearings to date. The transcripts are all up there and available, and very, very interesting content. Really, really useful suggestions and recommendations being made in that context. So if you know someone, if you're a participant or someone in your life would like to be involved in one of these avenues to share a story, please get in touch with us at NECA and we'll be able to give you some more information about that. There's a little bit of a snapshot. I won't get too much into that because I'm worried about running out of time. Yeah, I guess so that brings us nicely to the next point, which is what is NECA's role in the DRC? Simply put, we provide information about the DRC and its purpose and support the process of engaging with the DRC. And that's my phone number, the office number, which we're not there at the moment, but that's my mobile and email. And I will forward these slides on to everyone too, so that you'll have that if you should need. So how do we actually do this? How do we do the work that we say we do? Through community outreach like this, webinars, information sessions, newsletters, and through one-on-one meetings with individuals where we can discuss in length what supports they need to share their story. So that might look like sitting down with someone and figuring out whether or not they actually want to participate. Sometimes people have a story and they're not really sure if it's something they want to share, and they'll come away from a discussion with us either deciding, yes, I want to share that, or no, I actually don't want to share that. And that's, of course, their decision to make. Helping people plan the best way to tell their story, the most applicable and accessible way for them. We can arrange support around communication needs. We can give advice on issues and risks that might arise. So sometimes it's actually necessary to seek legal advice. We're not legal experts, but we can help the person access the free legal service available to people engaging with the DRC. Also, similarly, it can be distressing to recall events that have happened in the past. So professional counselling and emotional support is also available. We're able to link people into that service, whether it be giving them that information or sitting down with them and actually making that phone call, and any other individual advocacy issues that might arise with engaging with the DRC. So my final section, I'd love to turn the spotlight away from me and my organisation and onto you folks, the wonderful attendees. And I've called these slides Starting the Conversation, because I think we'll all agree that when you're advocating for somebody, you need to start with active listening, transparent communication, and starting where that person is at. So this seems like a really obvious point, but just if you're trying to have a conversation with somebody, making sure they have the communication aids and relevant interpretive services that they need. Also meeting in a safe and comfortable place. So if you're supporting someone and you get the sense that they might want to share that something's not quite right for them in their like their accommodation or their workplace, meeting them somewhere external to that can be really important so that they feel comfortable to share that. That can be a real challenge for people who live in segregated environments like closed institutions like group homes. So where am I at? I've looked away from my notes and now I'm completely adrift. So how to explain the DRC to the person that you support. It's a big process. There's lots involved, and yeah, it can be a bit confusing to get your head around. So some ways that the DRC suggests in their easy read guide are, it's an official way of looking into a big problem. It's going to help us work out what went wrong and what we need to fix. And it's also an opportunity to have your voice heard. So I think also, as I mentioned before, just clarifying the terms that the DRC uses, so violence, abuse, neglect, and exploitation, and that's where that slide that I had earlier is really quite helpful, because I think oftentimes people with lived experience of this kind of mistreatment don't necessarily always recognize that it's not okay, and it's sometimes a bit difficult to name it, particularly if that's something that you're very used to throughout your life. So it can be also useful to give examples like, you could be like, once at work, someone yelled at me when I hadn't done anything wrong. It was really unfair. That's actually an example of abuse, give that kind of examples in this way. But also using open-ended questions and trying to avoid leading the conversation and misconstruing, particularly when you're engaging with somebody who might be use alternate means of communication that aren't necessarily strictly verbal as well. Clarifying, of course, that it's their choice and they don't have to share their story if they don't want to, that nobody's going to be there forcing them to say anything that they don't want to say. Also, understanding what good would come from sharing their story. So when I presented this webinar last year to a group of advocates, a lot of questions at the end were around, well, how do I actually explain what we can expect in terms of outcomes to the person that I support? And in terms of really tangible outcomes, that's kind of difficult to say because there haven't as of yet been any, like the DRC is still gathering information, hasn't been a lot of recommendations made so far. But we can kind of look to royal commissions in the past as some kind of indicator. I think also just like talking through how sharing these things could feel really empowering for this person and could be a way that they can actually publicly have their voice heard too, if that's something that they want. Yeah, if you share your story, it might mean that it doesn't happen again to someone with disability, which would be a really good thing. Clarifying that their story can also be new or old. Someone might say, oh, but that happened, 20 years ago. How's it relevant now? That actually doesn't matter when you're sharing your story with the DRC. They want to know anything from any time period. It's all relevant and useful to know. Clarifying as well that there are legal factors to consider. Like I mentioned earlier, you definitely don't need to be a legal expert or know the ins and outs of these, and that's something that we can further support people with at NECO, and you're welcome to get in touch with any questions there. But letting people know that there are options available for them to remain anonymous as well when they're sharing their story, and that their story won't be shared publicly if they don't want that. If they do want that, that is something that they can actually opt in for too, for their story to be published along with their name. There've recently been a few changes to protect information shared with the DRC. So information is now protected for 99 years after the DRC, which wasn't previously the case. So we can all imagine that's like quite, that's very relieving. We're all very relieved to hear that because confidentiality is something that a lot of people were really, really concerned about for a long time, people with disabilities and their advocates. And it can be really dissuading for someone who wants to share their story. The idea that, there might be certain people who might find out that has been shared. So I think at the end of the day, I can give advice about how to have this kind of conversation, but the three main points that I'd really love for you all to take away are that the person that you support best, or at least better than myself. You don't have to do this alone. You don't have to have this conversation alone, and that we're here to help at Northeast Citizen Advocacy. So thank you so much for listening. I know there was a lot to get through there. It's quite dense. I've got some slides here with the information about the Blue Knot Foundation, which is the free counselling service that's available to anybody impacted by the DRC. So that could be people with disability themselves, family members, support workers, basically anybody here who would be involved with the DRC can actually access that service for themselves, as well as assisting somebody else to get in touch with them. And this is Your Story Disability Legal Support, which is the free independent national legal service providing information and advice. And again, I'll make those slides available to anyone who might like them, so that you can follow up on that in your own time if it's relevant. I'd love to answer any questions or hear any comments that people have to make, and I'm going to stop sharing my screen now so I can see all of your faces. Wonderful. There you all are.
Thank you so much. That was, really incredible. That information is very valuable. I think the work that you're doing and NECA are doing, I think, is really, really incredible. And thank you so much. Really appreciate it. Does anyone have any questions? Yes, Hangama, I will definitely send the slides to everybody with any relevant contact information. Does anyone have any questions for Amelia?
I do just have one, Amelia. Do you guys have a catchment area that you support people from within, or do you take people from, or support people from all over the place?
Great question. Yes, so it's the northeast. So that's off the top of my head, that is Darebin, Whittlesea, Nillumbik, and Banyule.
Okay.
Those LGAs. Yep. But we're also get in touch if there's kind of someone who you think, and it doesn't necessarily fall into those catchment areas, because we can always forward people on to other services as well. Yeah.
And it's just one other related question. Do you guys, probably beyond the DRC, do you guys provide other advocacy support for people with NDIS or provider issues and that sort of thing?
Definitely. That's a great question. Yeah, we have independent advocacy. That's its whole program. So that's kind of advocacy with more immediate things. And that's been really relevant during the pandemic. And I suspect as well I suspect as well that's why engagement is a little bit low on the DRC at the moment during the pandemic, because people have just like so much other stuff to be getting on with. Yes, we provide advocacy in that area. We also have a citizen advocacy program, which is kind of what our organisation is named after in our general ethos, which is a program that matches members of the community who are volunteers and who don't have previous experience working with people with disability with individuals. And the idea there is to have a kind of a more informal relationship that doesn't fall into those limitations of worker participant dynamics. Citizen advocates do a little bit of individual advocacy, but there's also an element of like increasing participation in the community there. So if any of those programs sound relevant to anyone that you support, can definitely give more information there as well.
Thank you so much.
Thank you, Mick.
Amazing, thank you. All right, we'll move across to Michelle. Michelle, sorry, did I put you on the spot, Michelle? Michelle is the coordinator of community programs, age and disability services at Yarra City Council. We've worked together on we've worked together a little bit over the last couple of months, chatting to each other about some of the work that you're doing and what we're doing. So I'm really excited to have Michelle here to chat about all of the things that she's working on.
Thank you, Nick. I'll try and keep this relatively short, but I wanted to share with everyone that Yarra City Council is funded in a number of ways to support carers in Yarra. We're funded under the Support for Carers program through the state government, which provides support to people, carers of any age with no visa requirements, and it really doesn't matter if a care recipient is on the NDIS or the home care package sort of stream in aged care. It's really about supporting the carer and the carer's role and relationship to the person that they're caring for. At Yarra, we have just since April last year developed a program around using our funding to provide digital equipment grants to carers in recognition that COVID-19, that traditional program of respite care that the state government funds doesn't really meet carers' needs in a lockdown, and that a better way of supporting that really crucial role in our community that carers provide is around keeping them connected in those ways that aren't necessarily in-home support. So we have a number of digital equipment grants that basically provide people, carers, with a choice of either a Chromebook laptop or an iPad or a Samsung tablet with internet connection through a Wi-Fi SIM card. And we work in partnership with our library services team to provide support with setting that equipment up, using it, as well as one-to-one training, either face-to-face in lockdown, I mean, we're not in lockdown, or over the phone with interpreter support available when we are in lockdown. I'd just like to point out that part of my business case to the state government was for this program, and this particular stream of the Support for Carers program was to try and reach hard to reach carers, that being younger carers under 25, carers from our ATSI community, our LGBTI plus community, our CALD community, and also carers of loved ones who have dementia. But I would just like to flag that, you know, depending on resources and what gets allocated, other carers experiencing carer stress or a risk of a carer relationship breakdown, I am happy to assess those on and for you guys to advocate those on a case-by-case basis. So I'm not eliminating any carer in the community, despite, you know, the focus being on hard to reach contact carers in Yarra. Sorry, I've just don't know why I said contact. I'll post in the chat my contact details and the referrer pathway that any of you have, if you want to get more information or refer someone that in Yarra that could benefit from this support. We also have residual funding for respite care, also under the Support for Carers program funded through state government to provide respite care to people in the LGBTI community. And that can be the carer identifies as LGBTI or an ally of the LGBTI community or the person they're caring for. And that can be up to 20 hours with some flexibility each year. I just want to quickly touch on, and I know it's not technically targeted towards carers, but Yarra City Council by default supports carers through the Commonwealth Home Support Program, which is through My Aged Care. And again, I'll put the contact details for My Aged Care on the chat. So our Commonwealth Home Support Program supports people over 65, or if they identify as Aboriginal, Torres Strait Islander, or people at risk of homelessness, it can be over 50. And we can provide up to 4 hours respite care to those people, which will support carers. However, if the care recipient is on a home care package, they're not eligible, unfortunately, for this support through the Commonwealth Home Support Program. And then finally, we also deliver, again, on behalf of the state government, services under our agreement for the Home and Community Care Program for younger people, also affectionately known as HACPIP. Similar to the aged care provisions, it's not available to people who are on the NDIS, but if they aren't meeting NDIS requirements or they're not on the NDIS, again, it's up to 4 hours of respite care per week that we can provide. And I'd just like to flag that under COVID-19, the state government has certainly recognised the challenges of a global pandemic, and they've increased their flexibility around eligibility for the HACPIP program. So it's really open to anyone caring for someone with a chronic condition, someone receiving palliative care. It could be mental health or anxiety. A disability support pension is not necessarily a requirement anymore, which historically it was. But, you know, referrals need to, I suppose, identify that the caring role can demonstrate that the person that they're caring for does require help with their activities of daily living. So that's basically me in a snapshot.
Amazing. There's so many, I guess, different elements to your role, which must keep you really busy, I can imagine.
It's all good. It's all good. I'm about to promote the digital equipment grants because last year we had a very small number. The state government has allowed me to roll over unspent funding. So there's probably I've got about 40 grants. So have I got time for this, Nick?
Yeah.
So I had originally the proposal was to do the LGBTI respite care, and I had one person over a 2-year period that actually accessed that support. So then I said, COVID-19 pandemic, it's not really, despite a lot of promotion in the community and on a lot of different platforms, wasn't a great uptake. Not abandoning that, but wanted to pivot into, well, what do carers actually need? And it wasn't in-home support. They didn't really want different carers coming in and caring for their loved one in a global pandemic. So the digital equipment was the stuff that the state government was happy to support. And compared to 2 years of running the LGBTI respite program where I had one uptake, when I pivoted that to digital equipment, I think in 2 months I had 26 carers accessing that support. So it's obviously meeting a quite a significant need out in the community, and I'm doing surveys now on how that has helped them in their caring role. And it's, I suppose, the big feedback that I'm getting back is being able to stay connected with family and friends that support them in that caring role, online with, you know, Zoom meetings, face-to-face, you know, what is it? I don't know, Facebook instant messaging or face-to-face. I don't know what it is. I'm not technologically savvy, but that has been really the most significant. But then being able to attend healthcare meetings for their loved ones on Zoom with hospitals or GPs or whatever their healthcare providers has been significant. And then it's also, as the carer, being able to pursue activities that are valuable to them around learning English and doing online classes, you know, accessing information that supports them around income support or services. It's just been, it's been a joy to deliver.
Sounds amazing.
Yeah.
Thanks, Michelle. Does anyone have any questions for Michelle?
Can you see my stuff in the chat? Can everyone see the pathway? Yeah. Oh, awesome.
And I've also going to copy and paste that into an email so that I can share that with everybody just in case they lose it. So, and anything else that you want to share with everyone?
Just that I try to make it as unintrusive as possible. I try to keep the data collection to the mandatory reporting requirements so that it's not an extra burden on carers.
Yeah, I think that's really important.
One question I just had, Michelle, which I think I should probably know the answer to this, but while you're talking, I realised I didn't. With the HACC PYP program, is that like time limited? So, you know, is it support, like you said, sort of 4 hours a week? Is it over a particular number of months, or is it an ongoing program?
That's an ongoing program, but we
Okay,
review all just our reporting requirements and the program guidelines. Is that if there's no issues that are identified that we need to react to, the standard is to review all our clients at least once a year to see how they're travelling and update as according to that.
Awesome, thank you.
Great. Thanks. All right. So last but definitely not least, Owen Weatherly from EACH, who is the team leader of the NDIS Access team. Thank you so much, Owen. So Owen's going to chat about his role at each and talk a bit about, the NDIS Access team. So over to you, Owen.
Thanks, Nicholas. Thanks for having me. I guess I'm the team leader for the Mental Health Access Project, which has been going for 2.5 years, just a bit over 2.5 years now. I've been team leader for the last 3-4 months, and previously worked in the team. But we also have a new program, which is short-term funding through till next June to the end of the financial year, which is an allied health access program. So it's all around both programs are around getting people with disabilities who may be falling through the cracks, giving them the assistance to apply to the NDIS and taking them through that process, which hopefully the Royal Commission that Amelia was talking about, it includes the NDIS, because it can be quite a difficult process to navigate, particularly with people who have serious mental health disabilities. It can be extremely stressful and a real barrier. So we're trying to pick up those guys. So I'll touch on the mental health team first. As I said, it's been going for a few years now, and it's been extended through to mid-23. We are, like a lot of mental health services, inundated with referrals at the moment, and have been for some time. But we've expanded our capacity to meet that. So basically, we get people with serious mental illnesses that have got a documented treatment history, because that's obviously one of the stipulations that the NDIS is really tight on. Individuals have to have shown that they have exhausted all treatment options or attempted to, in order for the NDIS to deem them as permanent lifelong disabilities and therefore be eligible. So a lot of our work is in the intake process, where we're just making sure that the client has that track record, and in a lot of cases needs a psychologist this end to confirm diagnoses, etc. So we take the client through that process. A lot of clients are not eligible because they really haven't done. They may be at a very early stage in a phase in that journey where they may have got a mental health care plan from a GP but haven't really engaged yet, and so we kind of guide them through and give them some ideas on how to move forward and instructions to come back in a year or so once they've done that. But for the guys for the clients that sort of we deem eligible, we then take them through the process. We touch base with treating professionals such as psychiatrists, psychologists, and support workers, etc., and get testimonies and evidence. We also dig into using freedom of information, dig into past documentation outlining, hospital discharges, etc., to just provide a bit more context at the submission to the NDIS to show that this person's illness or disability has been extensive. They've tried to obviously do the best they can in terms of mitigating the conditions, and that has failed, and then therefore they should be eligible. So we then tie that in with GP, which is kind of the gold standard in terms of the NDIS. They place a lot of weight on the documents and the information provided from the GP. So obviously that's a very first eligibility criteria that referees or potential clients need to have a GP willing to provide evidence. So that's the last stop, and we pull all that together in a neat little package and provide our thoughts as a cover letter outlining in detail the case, and then submit. And we then obviously fight tooth and nail through the process, through reviews and all the way to the Administrative Appeals Tribunal if necessary, which increasingly so we're finding a lot of pushback from the NDIS. So we fight the good fight, so to speak, and on average we get close to double the planned packages for people coming through us rather than the national average. So we hit hard, and we try to play their game and get the results. So yeah, that's kind of the mental health team, and yeah, so we're always on the lookout for organisations that have clients that may need the NDIS and have done what they can to help themselves, and may need that assistance. So that team, the mental health team, operates in the northeast, inner east, outer east, and southeast. So it's right across eastern Melbourne, which is where each operates, which is a little bit different to the allied health team, which has just started across Victoria. That has been separated up into a lot. In the mental health, there's only 3 organisations across the whole of Victoria. In the allied health program, there's 70. So we've all got a few LGAs. So we operate in Maroondah, Knox, and Yarra Valley in the outer east, and Casey in the southeast. And basically that's a similar program. Obviously it's a bit different. You're not operating in the grey area where, if you've got an allied health disability, there's usually a good assessment or a need for a good assessment, and then the NDIS will usually rule in favour. So the barrier there is more for people who may not have the means to pay for expensive assessments, particularly things like neuropsychological assessments for acquired brain injuries, etc. They can be upwards of $2,000. So our new team has a big block of funding that pays for those assessments. So people who are eligible for the allied health program, and we obviously go through that with them at intake. We also get the GP in on board quite early to confirm that yes, this disability is worth pursuing, and including the required assessments. We then book them in for assessments with the relevant allied health provider, and we pay for that. So whatever the cost may be, it obviously varies across the different allied health providers. And then the same sort of process, we get the GP's evidence, tie it all up, and submit and take them through the process as well. So as I say, it's a more limited program, the allied health. It's only around for 1 year, and obviously limited resources, so it's kind of filling up quite quickly. But yeah, we've still got plenty of room to take referrals for them, as well as the mental health. So yeah, I guess in general, both teams are similar. We're obviously doing battle with a very moving target, the NDIS, which I'm sure everyone is aware of. And in my time, which I've been with the team for a bit over a year, it's obviously become a lot more difficult with dealing with the NDIS, and I think that's a real issue. To see it from firsthand has been a bit of an eye opener, actually. You're dealing with assessors who, on the psychosocial side, are not trained in psychosocial at all. And there's a real tick the box kind of attitude. So yeah, we've had to adjust a lot, adjust what we're doing quite a lot as we're going, and adjusting month by month as they change their strategies. But I do feel for people who don't come through our service and are on their own doing this. But yeah, that's kind of us. That's the nature of the beast, and yeah, we're up for the fight. So yeah, I mean, obviously, I'll leave my details. I'll leave a little bit of information regarding both programs, and you can disseminate within the organisation. But we're open for referrals. So if this puts a light bulb on, and you've got a couple of clients that you think might be appropriate, then definitely get onto us.
I feel like there's probably millions of things we could talk about in terms of NDIS and the psychosocial aspect in the allied health. Like there's we could be here for hours.
That's right.
I feel like I've got so many things I want to say, but yeah, we're time limited. I think it's absolutely incredible work that you guys are doing, and I personally have referred a couple of people just only in the last couple of months, because I only recently kind of heard about the Mental Health Access Project, and I think it's absolutely incredible. I think we need more of that, absolutely, and I think it's just I think it's fantastic. So yeah, let us know, please, how we can refer people you know, whatever we can sort of do to get the word out. I've already heard a lot of good feedback from the program to the people, because we often get asked a lot about how we can advocate for people around NDIS and access and all of those things. And, you know, unfortunately, we sometimes just don't have the time, you know, in the work that we do with our carers and their care recipients. So, you know, to know that there are organisations out there that are doing this hard work, and a lot of the stuff you sort of said was, yeah, you know, really eye-opening in that regard. So, yeah, thank you so much. Does anyone have any questions for Owen? We've got about 8 minutes left. So, yeah, Mick.
Just to continue my theme, I just echo exactly what Nick said. I just think they're both wonderful and just such necessary programs. And I know lots of people who have just got caught in that nightmarish scenario of trying to get in. So that's really fabulous. One of the questions, or the question that occurred to me is, you mentioned, I think, on the Allied Health program that there are other organisations that cover other LGAs. Is there a website or something? Because I know, like, a lot of our catchment area covers some different LGAs. So if there are other places where we could find those pathways, that'd be really great to know, because I didn't know this program was there. It's just, it's fabulous.
Yeah. I think, I don't know how much they've promoted it from the department. It's been a bit of, here's the money, go away and do it. So I have got a spreadsheet that was provided from the department last week, actually, because I had the same questions, because we're getting referrals from other LGAs within each internally. And I'm having to sort of say, actually, we're not across that. So I might send that through so that you guys have got that list. It's the whole of Victoria, so every single LGA. And also with the mental health, I'll just outline, you know, briefly who's where. We're obviously Eastern Melbourne. NEMI is obviously Western Melbourne and the Bay Area, and then AXO is the rest of regional Victoria. So I'll just drop that down as well for everyone's reference. Yeah.
Yeah, whatever one you want to send through, I'll share it with everybody, and that same with Amelia and Michelle. If you think of anything later that you think would be useful for us to know, we can help, you know, promote things, give people that information and pathways to referrals. So yeah, that would be great. Any other questions for Owen or even in general?
Just Nick, if I think I've sent the flyer to you before.
Yes.
Yeah, so I don't need to send that again.
Yeah, no, you're all good. All
right, cool.
I can send that, and I've got what you posted in the chat. I can also repeat that in an email to people.
Just don't want to bombard you with duplicated work effort.
All good.
Sorry, my dog's barking. I'll turn myself on mute.
Well, if there's nothing else, we might just end it there. Thank you so much, Owen, Amelia, Michelle, and everyone for attending. I really, really appreciate it. It's all very valuable information. And also just know that, yeah, I will send the recording to the wider team. Everyone's very busy at the moment, so understandably, some people can't turn up to these sessions, but that's why we're doing the recording, so that people can watch them at their own time. And yeah, there's another session same time in 2 weeks, and I'll send everyone a reminder about that on the morning of. So thank you all so much, and enjoy your afternoon.
Thank you, everybody.
See you later.
Everyone. This has been really great. Thank you all.